hope you enjoyed those presentations. It is wonderful to hear of some of the work that's being done across the country, and it's really about how do we then spread it uniformly across the country as needed. So I'd now like to introduce Wes Streeting to you. As you probably know, he's the Labour MP for Ilford North and Secretary of State for Health and Social Care. He was first elected to Parliament in 2015. You may not realise how recently, in fact. And the other thing that's quite useful, I think, is that he spent 5 years as a member of the House of Commons Treasury Committee. Now that is a useful link, isn't it? He's Vice President of the Local Government Association and patron of LGBT plus Labour. In his professional life, he's worked as a senior leader in the voluntary sector, working for a range of charities focused on tackling educational inequality and disadvantage. So very much a man after our hearts. Comes from a working class family, went to Cambridge, to Selwyn College to read history, and is a former president of the National Union of Students. So I give you Wes Streeting.
Thanks very much for that introduction, Camilla. I'm glad the footstool has gone, because Streeting looks down loads of GPs is not the headline that I was looking for. Can I just begin by saying a public thank you to you, Camilla, and by extension to your college. In opposition, we engaged in good-natured but often robust debate about things we disagreed on, but more often than not found ourselves in violent agreement on the state of general practice today and our responsibility to rebuild general practice for a brighter tomorrow. And that relationship, built on mutual respect and a spirit of partnership, means I come here today feeling that not only am I among friends, but among teammates, which is a theme I will build on in my speech this morning. So in that same spirit, can I also say a special thank you to Sunaina, Paula, Rumshir and Andy for those outstanding presentations. Because you are proof that while the NHS may be in the grips of the worst crisis in its history, the biggest asset we have are the people who work in it. And more than that, you provide hope to a country that is desperately looking for it, because you are showing us not only is reform possible, it is already happening, and you are showing us what a reformed NHS could look like. I'm delighted to be the first Secretary of State personally addressing this conference in 7 years. Can't imagine what the others were so worried about. Although I imagine some of you are quite happy not to hear from my 7 predecessors, you've not gone for that time. The good news is I'm here this year. The bad news is that whether you cheer or boo, I'll be back for more next year. And that's for 2 reasons. Firstly, I always welcome challenge. And as you might have gathered by now, I actually enjoy a good argument. More seriously, I recognise that the health service is in a deep hole. And it's only by working together that we will get out of it. It's my job to mobilise nearly 2 million people who work across the NHS to be the team that takes the NHS from the worst crisis in its history, gets it back on its feet and makes it fit for the future. I can't do that on my own. We can only do it as a team. And that team spirit we need to build starts with honesty. The NHS is broken. That's what 2 in every 3 patients believe. And I suspect a poll of NHS staff would find the same sort of result. In fact, I'm yet to speak to a GP who tells me, on many of the visits I've done in the last 3 years, everything's going really well, my workload is entirely manageable, this is just what I signed up for. And I want to be clear about something else too. The NHS is broken, but GPs didn't break it. 14 years of Conservative government did. And that's not just my view, that's effectively the conclusion of the Darzi investigation. Now, I know he's a surgeon, I'm sorry about that. But I think that if you've read his report, his analysis is so stark and so clear, you might even forgive him for polyclinics. Lord Darzi found, and I quote, GPs are expected to manage increasingly complex care, but do not have the resources, infrastructure, and authority that this requires. Hospital resources have shot up, while primary care has been neglected. In fact, there are 1,500 fewer fully qualified GPs in the NHS today than 7 years ago. And while hospital productivity has fallen, the reverse is true in general practice. Despite there being fewer of you, you're delivering more appointments than ever before, squeezing the time you spend with each patient. And as RCGP's research this week revealed, it's the poorest areas that are hit hardest. Cuts to capital investment mean that 1 in 5 of you are working in buildings older than the NHS itself. And of course, you were at the thick of it when it came to Andrew Lansley's disastrous top-down reorganisation. In Lord Darcy's words, and I quote, "GPs, to all intents and purposes, were set up to fail." So we're left with a status quo that isn't working for anyone, not for patients, 2 in 3 of whom aren't satisfied with the service they receive, which is a record low, nor does the status quo work for staff. You are working harder than ever before, pushing you to burnout, and in too many cases, pack it in. Patients are frustrated, they can't see you. You're frustrated, you can't meet their demands, and this is not a sustainable position for anyone. The NHS is broken, but it's also not beaten. And I think what unites all of us, staff, patients, and crucially the evidence, is the shared conviction that continuity of care, what most people would call the family-doctor relationship, really matters. It's what drives patient satisfaction, your job satisfaction, and most importantly of all, better outcomes for patients. So it will be at the heart of this government's plan to reimagine the NHS as much as a neighbourhood health service as a national health service. We'll shortly be embarking on a wide-ranging and deep engagement exercise to build our 10-year plan. That 10-year plan will deliver 3 big shifts in the focus of healthcare, from hospital to community, analog to digital, and sickness to prevention. And general practice is fundamental to each one. Just look at what the GPs who spoke this morning are already doing. Paula is using basic technology to meet demand for same-day appointments and giving patients a digital front door, leading the way on ending the 8 a.m. scramble. Advances in big data, which I'll come on to talk about further, are going to transform the NHS's ability to end the cruel postcode lottery of health inequality. Rumshi is already showing us how, by taking screening, checks and care directly to the communities most in need, intervening early and preventing ill health from worsening, what we can already do. And as Andy and Sunena have shown, if we bring GPs together with colleagues from mental health services, community pharmacy and social care, all working in lockstep as one team, more patients can be treated in the comfort of their own home, where they want to be. That's the neighbourhood health service we want to build. That's the future of the NHS. And I hope you've seen in the last 3 months, we've started as we mean to go on. The Conservatives left GPs qualifying into unemployment this summer. While patients can't get a GP appointment, GPs couldn't get a job. You asked us to act, so we did. In what might be the first example in history of someone signing a petition that actually led to action, I received RCGP's petition, we cut red tape, found the funding, and we're recruiting an extra 1,000 GPs this year, which is our first step to fixing the front door of the NHS. In my first week as Health and Social Care Secretary, I pledged to increase the proportion of NHS resources going to primary care. And in our first month, the government made a down payment on that pledge, providing practices with their biggest funding increase in years. I've never pretended that that one measure on GP recruitment, or indeed the funding that was announced, was a panacea. But given the £22 billion black hole we inherited, and the painful cuts we've had to make and are having to make elsewhere, be in no doubt how hard we had to fight to deliver that extra funding. It was a serious statement of intent, a proof point, an early decision to demonstrate that we are serious about rebuilding general practice. Not everything is about more money, it's also about less waste. When I spend time shadowing GPs, one of the things they've been dying to show me is the sheer amount of paperwork you are required to fill in to refer a patient. I was genuinely stunned to hear about one practice that has to complete more than 150 different forms to refer patients into secondary care services. Practices spend as much as 20% of their time on admin and work created by poor communications with secondary care. This is intolerable. That time should be spent with patients. That's why today I can announce that Amanda Pritchard and I will launch a red tape challenge to bulldoze bureaucracy so GPs are freed up to deliver more appointments. That challenge will be led by Claire Fuller and Stella Vig, primary and secondary care leaders who have their bulldozers at the ready. Tell them what's working, but more importantly, what needs to change. We will listen, act, and solve this problem together. Amanda and I will receive the conclusion of this work in the new year, and NHS England will hold ICBs and trusts to account if they fail to act. The other frustration I hear from staff and patients alike are the pointless appointments you're forced to hold and patients are forced to attend. You didn't go through 5 years of medical school plus 5 years of training to tick boxes, so where there are appointments that can be cut out, with patients seen by specialists faster and GPs' time freed up to do what only GPs can do, we will act. Starting in November, 111 Online, which is available through the NHS app, will pilot directly referring women with a worrying lump to a breast clinic. That means faster diagnosis for cancer patients and more GP appointments freed up. Better for patients and better for GPs. And I suspect there are other cases that come across your desks every week where a patient has been passed to you by someone else in the NHS to refer them on to someone else in the NHS too. It is a waste of everyone's time, including yours. And where you give us examples of patient pathways that can be simplified through appropriate patient self-referral or direct referral by other NHS services to save your time, we will act. And it's not just that I value your time, I respect your profession and your expertise. General practice is a specialism. That's why I'm committed to the creation of a single register of GPs and specialist doctors, and this government will legislate to give the GMC the power to do it. It's symbolic, but it's also meaningful. It reflects the partnership I want to build with this profession. What I need from you in return is goodwill and the same team spirit. When the BMA's GPC returned their ballot result on collective action, I wasn't remotely surprised. I know that after years of rising pressures, declining resources, and a worsening service for patients, you feel it's your duty to sound the alarm. And trust me, you weren't the only ones who wanted to punish the previous government. But the Conservatives got the kicking they well and truly deserved on the 4th of July. Capping appointments now will only punish patients and make the road to recovery steeper. So be in no doubt, it is shutting the door on patients. Their care will suffer, receptionists will bear the brunt of their frustration, and the rest of the NHS will be left to pick up the pieces. Worse still, our collective job will be made harder. Collective action really means collective failure. Your message has been received, not from this one vote, but from all the time I've spent in general practice in the past 3 years, literally looking over GP shoulders and seeing what you deal with and the state of the crisis for myself. There's a reason that back in July, I rejected the list of hospitals suggested for me to visit on my first visit as Secretary of State and went instead to Dr. Ellie Cannon's Abbey Medical Centre in North London. I wanted to send a message that I understand how bad things are and that I'm determined to fix them. But I can't do this alone. We can only do this together. So I'm asking GPs to stand down collective action and instead work with this new government that is serious about working with you to rebuild our NHS together. There are some tricky issues that we'll need to navigate together. Take data. It's the future of the NHS. Advances in genomics and data mean the NHS will be able to do things never before possible. From the moment a child is born, we will know their risk of disease, giving you the tools you need to keep them healthy. Cancer could be detected from its earliest signs, saving countless lives. And the NHS will be able to treat patients with personalised medicine, far more effective with fewer side effects. That's the prize waiting for us. But beyond the day-to-day challenge of whether your machines reliably boot up and the number of passwords you have to enter across a range of applications, we don't even share patients' records across primary and secondary care. And I know there are issues, practical issues, we need to work through together around information governance, risk and liabilities. But there's also, let's be honest, some producer interest at play. But here's the consequence of inaction. Keir and I met a family at Alder Hey earlier this year. Their baby had heart surgery to save his life. When they'd taken the baby home and visited their GP, they weren't just surprised to find their GP didn't have sight of the hospital records, they were frightened. Imagine how those parents felt, a tiny life in their hand, in front of a medical professional who only had a partial sight on their experience. Imagine how the GP felt, having to ask basic questions about fundamental aspects of that baby's medical history. So we need to work together to create a single patient record owned by the patient, shared across the system, so that every part of the NHS has a full picture of the patient. And this applies as much to research as to care. The two go hand in hand. World-leading studies like the UK Biobank, Genomics England and Our Future Health are building up incredibly detailed profiles of our nation's health. Patients have given their consent for their data to be shared with these studies, but we still see far too often that this data is not shared according to patients' wishes. That's why I'm directing NHS England to take this burden away from you, just like they did during the pandemic. If a patient explicitly consents to sharing their data with a study, NHS England will take responsibility for making this happen. And in return, we will demand the highest standards of data security. My concern is that this isn't just an information governance issue, it's a culture issue that, unless addressed, will not only exacerbate the shortcomings of the system today, but will also squander the potential of tomorrow. A world in which genomics, AI and machine learning will combine to change our entire model of care, not simply to drive earlier diagnosis and treatment, but to predict and prevent illness in the first place, is a world we've got to embrace. The UK could lead the world in medical research. The NHS, created in 1948, a single-payer system, is ideally placed to harness the benefits of the revolution in science and technology in a way that Attlee and Bevan could never have imagined 76 years ago. This isn't just about the system, the model, also the ethos. Why do we pay our taxes into an NHS that is free at the point of use? Of course, it's because we all derive a personal benefit, but it's also because we are paying in for the common good. In this century, our data will be as valuable as our taxes. We contribute our data in the knowledge that it would lead to more personalised medicine, but also because it will contribute to better care for everyone. It's that collectivist ethos that created the NHS in 1948 to see us through the 20th century that will underpin an NHS fit for the 21st century. And nothing I've experienced or seen in the last 3 months as our country's Health and Social Care Secretary has weakened my conviction that while the NHS may be broken, it is not beaten. But the future isn't just in my hands, it's in yours too. The 3 shifts that underpin this government's reform agenda, from hospital to community, analogue to digital, sickness to prevention, those shifts are not new ideas and they are not radical, but delivering them really would be. I can't do it on my own. I need every part of the NHS to pull together as one team with one purpose, to be the generation that took the NHS from the worst crisis in its history, got it back on its feet, and made it fit for the future. That's the mission of this government, and I'm confident that together we will rise to it. Thank you.